Hi, this is Cyndy Minnery. I'm a nurse with Daybreak Retirement Villa. It's an assisted living facility, and today I'd like to talk to you about change of condition at end of life. We all know that at end of life we can choose to go with a hospice provider in assisted living. When you do this, there are certain things that might happen to people at end of life, and some of these things are common, so I want to cover them. The first is dysphagia. Dysphagia is difficulty swallowing. Now, most of us over the age of 85 are going to have some kind of dysphagia just related to changes in our structure as we age. The other reasons you might have difficulty swallowing are if you had a stroke, if you have dementia, Parkinson's, or weakness after a surgery, or just weakness due to debility. So what happens is you'll have difficulty swallowing, and the way we'll notice it is because the resident will cough while they're eating or drinking. The things we can do to help alleviate some of the symptoms of coughing is we can cue the resident to tuck their chin. Sometimes if you tuck your chin, that helps with swallowing. You can also give them a mechanical chopped diet or a pureed diet. That will help with swallowing. Also, you can thicken the liquids with a thickener. That helps with swallowing. The other thing you want to do is have the resident sit up at a 90-degree angle and then stay up for at least 30 minutes after the meal, so that if there's any kind of regurgitation, they'll have an easier time swallowing again. If swallowing becomes such an issue that the food goes down the wrong pipe, that is what we call aspiration pneumonia. Now, with aspiration pneumonia, what you're going to notice is probably an increase in sputum production, increase in coughing. You're going to notice a fever. You're going to notice a decrease in oxygen concentrations if you use that O2 sat meter. There is a treatment that is available. You can try calling the doctor of the hospice and get antibiotics. To be effective, the antibiotics have to be ordered very quickly. And every time you talk to the family about antibiotics, make sure you get them to understand the upside and the benefits and the risks of giving an antibiotic. Not everyone should have an antibiotic. If this is something that the resident has been doing frequently, you're going to see that happen again. The other thing, when people start to decrease the amount of liquid they're taking, you're going to see skin breakdown. If people don't get as much protein, you're going to have less albumin in the blood, so you're going to get more chance of skin breakdown. The things that you want to remember with skin breakdown is keep the resident dry, turn them frequently, and use an alternating pressure pad. The other thing you're going to notice when people drink less is an increase in constipation. So what you want to watch for is the frequency of the bowel movements, the size, and the consistency. If you've got frequent small bowel movements, there could be an ileus that's starting to form, and that's where the bowel movement actually hardens and it can perforate the bowel and cause a lot of problems. So we want to make sure that we keep the bowel moving, we keep the bowel movement soft. You also want to communicate with the hospice nurses to make sure they offer laxatives and stool softeners appropriately. The other thing that can happen when residents don't drink as much is we can get urinary tract infections. So we can see a decrease in urine output. The kidneys might start to shut down. So we want to watch for, again, fever or signs and symptoms of urinary pain, and we would want to contact the doctor, the hospice physician, to get an antibiotic ordered. But again, you need to contact the family and get permission from the family to get the antibiotic. The last thing that I want to talk about with people who are declining in hospice is new or worsening pain. And what you want to watch for is the amount of facial grimacing or complaining that a person is doing with pain. Communicate again with the family or the hospice nurse to make sure you've got the right pain medication. Then when you do give a medication, make sure that you are monitoring the response of the resident and make sure you're recording the response so you can tell the hospice nurse if that medication is effective or if you need to increase the strength of that medication. Remember too that opioids can cause an increase in constipation, so we want to remember to offer more stool softeners for opioids. Thank you for listening today, and we'll catch you next time.